social, social sector, including healthcare. When asked what he intends doing for regeneration of India, Swami Vivekananda had said, no amount of politics would be of avail until the masses in India are well educated, well fed, and well cared for. I now proceed to present the key element of my proposal in the social sector. In our country, cooking gas cylinders were considered an upper middle class luxury. Gradually, it spread to the middle class, but the poor do not have access to cooking gas. Women of India have faced the curse of smoke during the process of cooking. According to the experts, having an open fire in the kitchen is like burning 400 cigarettes in an hour. Time has come to remedy this situation. We have decided to embark upon a massive mission to provide an LPG connection in the name of women members of poor households. I have set aside a sum of rupees 2,000 crore in this year's budget to meet the initial cost of providing these LPG connections. This would benefit about 1 crore 50 lakh households below the poverty line in the year 2016-17. The scheme will continue for at least 2 more years to cover a total of 5 crore BPS households. This will ensure universal coverage of cooking gas in the country. This measure will empower women and protect their health. It will reduce drudgery and time spent on cooking. It will also provide employment for rural youth in the supply chain of cooking gas. I want to take this opportunity to express our gratitude and appreciation of 75 lakh middle class and lower middle class households who have voluntarily given up their cooking gas subsidy in response to a call given by the Prime Minister. Their gesture is a matter of pride for the country. Catastrophic health events are the single most important cause of unforeseen out-of-pocket expenditure, which pushes lakhs of households below the poverty line every year. Serious illness of family members causes severe stress on financial circumstances of poor and economic weaker families, shaking the foundations of economic security. In order to help such families, the government will launch a new health protection scheme which will provide health cover up to rupees 1 lakh per family. For senior citizens of the age of 60 and above belonging to this category, an additional top-up package of rupees 30,000 will be provided. Quality medicines, making quality medicines available at an affordable price has been a key challenge. This will reinvigorate the supply of generic drugs. 3,000 stores under the Prime Minister Jan Aushadhi Yojana will be opened during 2016-17. Almost 2.2 lakh new patients of end-stage renal diseases get added in India every year, resulting in an additional demand for 3.4 crore dialysis sessions. With approximately 4,950 dialysis centers in India, largely in the private sector, concentrated in major towns, the demand is only half met. Each dialysis session costs around rupees 2,000, an annual expenditure of more than rupees 3 lakhs. Besides, most families have to undertake frequent trips for long distance to access dialysis services, incurring heavy travel costs and low wages. To address this situation, I propose to start a national dialysis service program. Funds will be made available through a PPP mode under the National Health Mission to provide dialysis service in all district hospitals. To reduce cost, I propose to exempt certain parts of dialysis equipment from basic customs duty, excise CVD, and SAD. Scheduled caste and scheduled tribe entrepreneurs are beginning to show great promise in starting and running of successful businesses. The Prime Minister had given a call for promoting entrepreneurship amongst the SC/ST to become job providers rather than job seekers. I am happy to inform you that the Union Cabinet has approved the Stand Up India scheme to promote entrepreneurship amongst SC, ST, and women. 500 crores has been provided for this purpose. The scheme will facilitate at least 2 such projects per bank branch, 1 in each category of entrepreneur. This will benefit at least 2.5 lakh entrepreneurs in this category. We are celebrating the 125th birth anniversary of Dr. B.R. Ambedkar. This must become the year of the economic empowerment for SC, ST entrepreneurs. We have extensively interacted with Dalit India Chamber of Commerce and Industry on building an entrepreneurship ecosystem. It is proposed to constitute a national scheduled caste and scheduled tribe hub in the MSME ministry in partnership with industry associations. This hub will provide a professional support to scheduled caste and scheduled tribe entrepreneurs to fulfill the obligations under the central government procurement policy, adopting best practices and leverage the stand-up initiative. The scheme for welfare and skill development of minorities, such as multi-sectoral development program and Ustad, shall be implemented effectively.